Hi everyone, day 7, an update. It's been 1 week since, exactly 1 week since I had the transplant. So this time last week I was in Istanbul, and around about this time I would have been just having the grafts placed in the front of the head. So I thought it would be good to give an update at this point, just to let you know how things are going. And things are going okay. Things are going fine. The the hairline, the hair, the donor, the transplant side is starting to look better and better. The scabs are starting to slowly go with every daily wash. You've got to wash. I've got to wash the hair every day very gently, like I said in the previous video. There are still scabs there, which, it's a little bit gross, but yeah, I'll show you. The transplant site around the side of the head, the back of the head, that has also scabbed over, but is very, very tender, as is the very front hairline. If I tap the shampoo onto that site, it's very, very, very tender along the front, and at the back, it's over the past couple of days has been quite painful. I've managed with paracetamol, but last night I did have to take codeine because the paracetamol wasn't shifting the pain, and I just could not sleep, which is kind of the issue at the moment, is the sleep. I'll get to that in a second though. So here, hopefully you'll be able to see close up, is the hair at day 7. So you can see lots of scabs and whatnot, and I'm not sure, you might be able to see the crown area if I tilt my head forward a little bit. But yeah, the sides are settling down a little bit. It's still quite numb in places, tender in places as well. The very top of my head here is numb. I don't kind of only just very lightly press, like I can't feel that. But if I press there, it starts to get really ticklish and itchy at another spot. So I try not to touch my head. So yeah, the pain at the back is, I expect pain. You've had you've had thousands of holes poked into your scalp, so there's going to be pain. It's just, I was hoping it would have kind of settled down a little bit by now, but yeah, paracetamol is kind of the main thing that I'm taking. There's nothing else I can do really other than wait it out and see how it improves. So daily washes, every morning I put a solution on, leave it for 20 minutes as per the clinic's advice, and then wash it off, and then use the special shampoo what they give you, gently dab it on the area around the back and the front, and then rinse it off with a slow flow of water. So on Monday, which will be day 10, Sunday and Monday, this weekend, will be days 9 and 10. That's when the schedule says that I should be a bit more aggressive is the wrong term, a bit more, I'll use the term aggressive, a bit more aggressive in the hair washing. So you've got to really work out the crusts and the scabs, because that will impede, as I understand it, the hair developing and the hair growth and whatnot. So yeah, those scabs need to be gone by Monday, if not, the vast majority of them. So I need to be a bit more vigorous in the hair washing, not yet. The sleeping is the main issue for me at the moment. Anybody who knows me and my friends will know that I can sleep anywhere at any time. I can just drop off and that's it, I'm out. I'm struggling at the moment. I'm up quite a lot of the time during the night, either just because I'm conscious that I'm moving about. I've got a neck pillow which restricts the movement a little bit, but that gets uncomfortable. So you're never fully asleep, if you get what I mean. It's always a very light sleep and conscious that you might have knocked your head or touched your head or your hairline. So I'm counting down the moments for day 10 where essentially I can get back to normal sleeping and without the neck pillow and that type of thing. So yeah, yeah, that's probably the main complaint. And if that's the main complaint, then I think I'm doing pretty well. So I hope you like the look of it. I do, and I don't suit a shaved head even with a bit more hair. So I am really excited to see what it's going to be like when the hair starts to grow, which I'll get a small sample of over the next week or two. Where the scabs fall off, there'll be some hair there. It looks like it'll grow. It looks like it's growing, sorry, and then it'll fall out. And then eventually it'll start growing over the course of a few months onwards. So yeah, I am pretty excited for that. In terms of the Finasteride and minoxidil, Finasteride, I've resumed them. I resumed them yesterday. Yeah, yesterday. Now, in one of the previous videos, I did query why the surgeon had told me to stop using these two for the next 4, 5, 6 weeks or something like that, to resume them and then to stop them after a year. Now, just to quickly recap, these tablets are kind of the gold standard, if you will, of male pattern baldness and trying to prevent it and whatnot. These tablets here, Finasteride, are 1 milligram, and I take one every day. They stop DHT, testosterone, affecting the hair on the scalp that is prone to falling out due to male pattern baldness. Now, that tablet, I started them probably about 6 weeks ago before the transplant. The oral minoxidil, now tablet version, are 2.5 milligram, and that's once a day. They also come in the topical foam solution, which you'll have seen in supermarkets, called Regain or whatever. I don't like the foam. I didn't like how greasy it made the scalp and stuff like that. So I sourced a tablet version of the medication, which I'm really happy with, and that increases blood flow to the hair follicles in the scalp. As I understand it, it dilates the blood vessels in the scalp, and that in turn strengthens the hair follicle, and that subsequently makes the hair stronger. So those two combined give the best chance of you keeping your hair, or most of it, strengthening the hair, perhaps even regrowing some of that hair, potentially. It's so itchy. It's so itchy. I could just scratch it to death. I really could. It's so itchy right now. Just tap it, Stephen. Just tap it. Very lightly. That'll do. Oh God, that feels so good. So yeah, those tablets, I've resumed them. I had 5 days off them after the transplant, but now I've restarted. It just made sense to start them. So there was increased blood flow to the newly transplanted hair, and the testosterone then wasn't kind of affecting the rest of me hair. So yeah, it made sense to restart them, to cut a long story short. And I'll resume them now indefinitely, as long as I can afford them and they're not causing me any health issues. I'll keep on taking them, because I don't think, well, I know I haven't seen the full effects of those medications, because I'd only taken one for 6 weeks, one for about a week before the transplant, and they take a good number of months for it to get into your system to start affecting the hair and to hopefully improve it. So yeah, I think the next 6 months will be quite exciting, and I am excited, and I'll continue to do updates on the hair transplant along the way. Like I said before, I've had quite a lot of people message on a daily basis asking how it's going, what prompted me for to do it, why I chose Turkey, Istanbul, why I chose the clinic, and all that type of thing. And I'm really glad people are messaging about that, and I'm more than happy to answer questions. So please do get in touch if you're considering it, or you're just starting to notice your hair thinning. What could be your options? It might be, I'm not the font of all knowledge. I'm just going through this as a first timer, but I'm happy to give pointers along the way and give bits of advice, information about what I picked up. Feel free, get in touch. I'm more than happy to answer questions, but no regrets so far. Thanks, guys. Take it easy. Bye-bye. Oh, something I never usually say, but like and subscribe if you can. Cheers. Bye-bye.